This section shows some simple exercises that you can do after your subacromial decompression. If you have had a nerve block, wait until it has completely worn off and you have normal feeling in your arm before you start these exercises. Pain is a personal experience and varies considerably with this surgery, but remember, you cannot damage the surgery that has been done. It is normal to feel aching, discomfort or stretching sensations when doing these exercises. However, intense and lasting pain is an indication to change the exercise by doing it less forcefully or less often. Generally, be guided by your pain levels. If you experience an increase in pain at night and when your arm is resting, you may be doing too much. If necessary, use painkillers, heat or ice packs to reduce pain before or after you exercise. Do short, frequent sessions, for example 5 to 10 minutes 4 times a day, rather than one long session. If you're able, exercise your shoulder until you see a physiotherapist or doctor at your follow-up appointment. All exercises in the video are shown for the right shoulder. The first 4 exercises are about regaining your arm movement overhead. You can do them all or choose the exercise which suits you or your routine the best. Exercise 1. The pendulum exercise. Find something secure to lean on with your unoperated arm. Lean forwards as much as you can and let your arm hang down. Gently begin to swing the arm with small movements. Use your body weight rocking forwards and backwards to help the arm swing. Then move your hand in small circles in both directions. Try and keep your arm as relaxed as possible, so the muscles are not working hard and the arm feels floppy. Do each movement 10 times. Exercise 2. Overhead movement in lying. Lie on your back. If needed, use a small towel under your upper arm. Hold your operated arm with your other hand for support. Lift your arms up in the air with your operated arm being helped up through the movement. Gradually increase the movement so you're aiming to get your arms overhead. Do not force the arm and find a gentle rhythm. You can gauge how far you are moving by looking at your hand position in relation to your face. Repeat 10 times, holding it at the end of the range for 10 to 20 seconds. If you prefer, you can hold a stick, for example a broom or walking stick, between your hands, and this can change the position of your arm and may make it more comfortable. This exercise tends to be easier to do in lying, but you can also do it in standing or sitting. And remember that your other arm is giving assistance, making the movement easier. Once you are comfortable with the movement, reduce the help from your other arm until you are moving your operated arm by itself. If you find you're arching your back or it's just more comfortable, bend your knees with your feet flat. Exercise 3. Table slides. Find a flat surface, probably a table or kitchen worktop is best. Place a paper towel or drying up cloth in your hands, anything that is slippery on the surface. Bending your knees and sticking your bottom out backwards, start sliding your hands forwards. Gradually increase the movement and if needed, take a step away from the surface. Try and keep your body level. If you cannot feel a stretch, turn your head to look under your opposite armpit when you're down as far as you can go. Repeat 5 to 10 times. Exercise 4. Wall slides. Stand facing a blank wall or door. Hold a cloth or paper towel in your hand if needed to make the surface more slippery. Slide your hand up the wall. If necessary, help your operated arm with your other hand at the elbow. Gradually slide your hand higher, working into tightness or stretch rather than pain. Repeat 5 to 10 times. Exercise 5. Sitting in a chair with a back, place something like a rolled towel or t-shirt in between your body and elbow. Use a stick, such as a broom handle or umbrella, held between your hands. Keeping the elbow tucked in, use your unoperated arm to guide your hand outwards. This causes rotation at the shoulder. Keep the elbow in against the towel and don't let the towel fall out. Note that the shoulders are still facing forwards throughout the exercise. Repeat 5 to 10 times, holding at the end of movement for 10 seconds. Exercise 6. Keeping your arms as relaxed as possible, shrug your shoulders up and backwards. Hold the position for a few seconds. You may feel the muscles in between your shoulder blades working, as well as some tightness on the front or the back of the chest. Some people find it helpful to think of squaring the shoulders. You can experiment with slightly different angles of movement, finding areas that are tight or weak. From the side, you can see that the sternum or front chest bone is rising up. Please note that the arms are staying still by the side and are not helping by pulling backwards. Repeat 10 times, holding for 10 seconds. You can then test that the arms are not involved by allowing the elbows to move forwards, but still keeping the shoulder blades back. Exercise 7. Muscle training, shoulder blade muscles and back of arm. Lie on your stomach with your forehead resting on a rolled up towel or t-shirt. Have your nose off the towel so you can breathe. Tuck your chin down slightly into your chest. If this is a painful position for you, try it with a towel placed under the front of your shoulder. This is not shown. The exercise is to move your shoulders up or back off the bed, keeping your arms relaxed. Imagine there is a small ball or orange between the front of your shoulder and the surface. Keep your arms relaxed with your hands down. Hold this position, breathing normally, and try and keep it there for 30 seconds. Note that the arms are staying relaxed and the head is down on the towel throughout. You may find that you cannot do this initially. Build up your strength and stamina gradually until you can repeat this 4 times. That is 2 minutes of work in total. Once you can hold your shoulder blades for 30 seconds 4 times, then lift your operated arm up and down. Only lift as high as your bottom and touch the surface with your hand every time you move the arm down. Throughout the exercise, keep your shoulder blades up or back in the position you have practiced before. You are aiming to keep the shoulder blades in this position whilst your arm lifts and lowers for 30 seconds, with 4 repeats again. Note that the elbow is staying quite straight, so that the movement is coming from the shoulder. Keep practicing, especially if it is more difficult on your operated side. If you feel your back muscles are working hard during this exercise, or if you have back pain, place a cushion or pillow under your stomach. Tighten your stomach muscles towards your back before you raise your shoulders. This flattens your back and switches off your back muscles. It may make the exercise more difficult. Once you can repeat the arm raising exercise 4 times, 30 seconds, add a weight in your hand. Start with 500 grams, such as a full half-litre water bottle. Continue the exercise with gradually increasing weights. You're aiming for the operated arm to feel similar to your other arm, assuming that that one has no problems.